Infection control. Here at Divine, we have policies and procedures that we use to minimize the risk of spreading infectious diseases to our residents, staff, and visitors. We have aware manuals in each department, and it talks about policies and procedures for infection control, safety, disaster, employee right to know, and employee health ergonomics. What causes infections? Pathogens. What is a pathogen? A pathogen is a disease-causing microorganism, also known as a germ. Pathogens can be prevented by cleaning contaminated things using medical asepsis, which is hygiene and clean practices. This decreases the number of germs that cause disease, and it educates our patients about washing their hands and coughing into their sleeve or using a Kleenex. Right now we're going to talk about our concerns with communicable diseases, contagious diseases. Communicable diseases are usually transmitted person to person or by shared use of a contaminated instrument or materials. Examples of communicable disease would be flu or colds. A nosocomial infection is when a resident acquires an infection while in our healthcare facility. We keep track of nosocomial infections because it does show how well we practice our infection control procedures. Flu. The origin of the flu. Thousands of years ago, it is hypothesized that when a man domesticated animals, organisms from them that were identical or closely related to the human form infected them. Known facts about the flu. People 65 and older account for more than 90% of influenza deaths. Adults can spread flu the day before getting symptoms to 5 days after symptoms starts, and children can do it for 10 days or more after symptoms start. Flu is spread by direct contact with secretions, is transmitted person to person or infected droplets, or through spread when a person coughs or sneezes. And indirect contact with secretions such as touching surfaces or touching your eyes, nose, or mouth. How we prevent the spread of communicable diseases here at Divine. To prevent the flu, we recommend that you avoid being closer than 3 to 5 feet apart, depends on the source that you read, how far apart they say. Stay home when you're sick. Call in 2 hours prior to your shift. When coughing, cover your nose, mouth with your sleeve or tissue, and wash your hands frequently. Avoid touching your eyes, nose, or mouth. Employees and residents should get a flu shot each fall, and residents are offered a flu shot pneumonia vaccine every 5 years. Symptoms to stay home from work. A fever over 101 degrees, sneezing, chills and sweat, headache, cough, muscle aches and pain, nasal congestion, decreased appetite, vomiting, or sore throat. Call in at least 2 hours before your shift to your supervisor. Report your symptoms to your supervisor, who then reports them to the DON, who needs to fill out forms. And if you are not ill, please don't call in. Just call in for a personal day. Return to work. When your temperature returns to normal without use of any drug to reduce it, other symptoms are absent, and if you need to be out over 72 hours, we need to have you have a physician fill out a form for you to come back to work. Detection of communicable diseases. We have an investigation and control of infection process. The DON is in charge of this. The supervisor fills out the employee illness form. When someone calls it for work, they put in the DON box. The DON tracks the illness. She's going to look into residents and staff who have similar symptoms. To detect also, we have visitors are not allowed to visit if they are ill. An epidemic may impose us to have visiting restrictions. We have signs at the entries that no one can come and visit. That's happened a couple of times. All employees responsible for this information. Infection control, we monitor that quarterly. We have a quality assurance file, and then staff development maintains records that you've been trained in infection control for 3 years. Spread of disease. Potentially infectious body fluids. Basically anything that's wet that comes from the human body is infectious. Now, an infection will start with a bacteria, virus, or fungi, whatever, and it would get into a person, a reservoir, so that they can live. And then when the person gets ill, it can be, the organism can be exit the person's body by excretions with the skin, droplets when they're coughing and sneezing. Then the next person to get the disease would have to get it through direct contact or airborne ingestion. Then it would enter the next host through the mucous membranes, the GI tract, the respiratory tract, or some broken skin. And if it's a susceptible host, someone who's immunosuppressed like our residents are, they are much more likely to get the disease than someone who is not immunosuppressed. Transmission potential. Contact with another person's blood or body fluid that may contain blood, mucous membranes, eyes, nose, and mouth, non-intact skin, and contaminated sharps and needles. Tuberculosis. Tuberculosis is caused by the Mycobacterium tuberculosis. It can be infectious if it's active, and it can be a dormant disease and be considered inactive. If untreated, tuberculosis has a high mortality. 33% of untreated patients die within 1 year. Tuberculosis usually occurs in the lungs, sometimes in the back, joint, abdomen, heart, etc. But more often than not, it occurs in the lungs. Signs and symptoms of inactive TB. Now, they may not show their symptoms at all, and they won't even know that they have it. It's usually diagnosed with a TB test, the Mantoux test. Active TB signs are chronic cough, fever, chills, weight loss, weakness, airborne diseases spread by droplets. Diagnosing tuberculosis. We do that with a skin test, which you get when you're hired, and chest x-ray. It's another way to test for tuberculosis. There's a positive Mantoux test. It's hard to see, but it's raised. It's not just the redness. It has to be raised. It can be just red and be negative, but if it's not, if it's raised, then it's positive. Testing for tuberculosis, as I said, the Mantoux test or an x-ray being positive. If here at the nursing home you were found to be positive, we would send you to the hospital and have you have a chest x-ray. And as I said earlier, your first Mantoux is given when you're in orientation. Then it is read in 2 to 3 days by a licensed nurse. The second Mantoux is 1 to 2 weeks after the first, and the second is read 2 to 3 days after by the nurse. If the series is not completed, you cannot work. Currently, the state wants us to have the whole first series done before you can start working. So in other words, you have to get the injection, wait 2 to 3 days to have it read, and then you can start working. Tuberculosis, positive Mantoux. If we find out you have a positive Mantoux, again, as I said earlier, we'll have you go for an x-ray, and then we'll have Dr. Murthy order the chest x-ray, and the nursing home pays for that chest x-ray. And if you are positive, they do have treatment with antibiotics. Bloodborne pathogens. What is a bloodborne pathogen? A microorganism that's carried in the bloodstream that can cause disease in humans. Malaria, syphilis, hepatitis B and C, HIV. What jobs are involved with blood at times? Class 1 employees are often exposed to blood and body fluids, so they are offered the hepatitis B vaccine. Class 2 employees are sometimes exposed to blood and body fluids, but we still offer them the vaccine. And Class 3 employees are not offered the vaccine because they never come in contact with blood and body fluids of the residents. Class 1 and 2 employees can clean up areas contaminated by large amounts of body fluid. AIDS. Human immunodeficiency virus. HIV is a virus that leads to AIDS. HIV depletes the immune system. One good thing about AIDS, it does not live well outside the body, and to protect yourself from it, we use something called standard precautions. Hepatitis. 1 to 1.25 Americans are chronically infected with hepatitis. It can lead to liver cancer, liver failure, and death. Hepatitis is found in any body fluid. It enters the body through its mucus, your mucous membranes. I had a friend when we were in the liver transplant ICU, and she got splashed in the eye with body fluids, and she did come down with hepatitis. So it really does happen. Symptoms of hepatitis would be jaundice, fatigue, abdominal pain, loss of appetite, intermittent nausea, vomiting. The Heptavax vaccine has been available since 1982. Hepatitis can survive for at least 1 week in dried blood, and symptoms can occur 1 to 9 months after exposure. Preventing hepatitis B. Employees may decline to have the vaccination. We have a form for you to sign for that. You must be 18 to accept it. Otherwise, I need permission from your parents. But most people who are under 18 at this point in time have already had the hepatitis series. And it is given at 0, 1, and 6 months. You need 3 doses. The last dose has to be 5 months after the second dose. We test titers 1 to 2 months after the series is finished. And we have blood titer drawn. And for the blood titer, your doctor will order it, and then they will bill Divine Providence. Hepatitis C is the most common chronic blood-borne infection in the U.S. Its symptoms include jaundice, abdominal pain, like the other hepatitis B symptoms. It may lead to chronic liver disease and death, and protection is standard precautions. Precautions. How do you protect yourself from disease? The purpose of isolation is to prevent the spread of communicable diseases via indirect contact and direct contact to residents and employees. Every resident is a possible carrier of a communicable disease. Disease can be transmitted by direct and indirect contact with germs. They have many names for precautions: universal, standard, body substance isolation, contact isolation, strict isolation. The Center of Disease Control has established 4 types of isolation: standard precautions, contact precautions, airborne precautions, and droplet precautions. Standard precautions. That involves something that you're going to do all the time. You're going to do hand washing all the time. If you're going to come in contact with any kind of fluid, you would be wearing gloves, a mask if there's going to be any fluid around your face, and an eye protector if there's going to be fluid around your eyes, and a gown if it might get on your clothes. And the best thing to think about standard precautions is if you're going to touch anything or it's going to touch you, you need to have a barrier. Contact isolation. Contact isolation is standard precautions plus contact precautions. The difference is gloves. You wear gloves when you enter the room, and you remove them before leaving the room. And it's because whatever someone has, it can live on like a table or something. So you need to have that extra protection. Whereas with standard precautions, you just have to wear gloves when you're going to come into contact, for sure, with any kind of body fluid. A gown to protect you from environmental services. We limit those patients' transport. We double bag their trash and laundry. The patients would keep their own equipment. They would have a commode if their urine or bowels are infected, and they'd have preferably a private room. And we do hand washing 1 to 2 minutes after care with someone in contact precautions. Some diseases would be MRSA, scabies, parasite that gets in the skin, bursts under it and causes a rash. Colds, VRE, resistant enterococcus, that's what VRE is. Hepatitis A, and flu. The resident not in a private room is given their own commode. They change gloves if you have contact with any infected material. Droplet precaution. Droplet precautions are standard precautions plus droplet precautions. A private room is preferred, but it doesn't have to be that way as long as they're 3 to 5 feet away from the resident. The patient's door can be open. You need to wear a mask if you're closer than 3 feet to the patient. And transport is limited for these patients, and they should wear a mask when they are transported. And again, you need to do hand washing 1 to 2 minutes after care. Droplet diseases would be flu, whooping cough, mumps, meningitis. And again, these are spread by the mist that comes out of a person's mouth when coughing, sneezing, or laughing. Airborne precautions. We wouldn't be able to have someone here with airborne precautions. We don't have the proper type of room, but for some reason the hospitals are full. This is what we would do. There's a respiratory, a mask that's called an N95, and I have a picture of it here. It helps occlude all the air coming in on the sides of the mask, and all the air will go through a filter. We try not to transport these patients. Ideally, it should be a private room, and again, that negative air pressure room we don't have. Again, you need to do the 1 to 2 minute hand washing, and obviously we would try to transfer this type of patient. Airborne disease would be tuberculosis, SARS, smallpox, measles. Implementation of precautions. When the doctor orders it, we would implement precautions. A lab result would show that someone had some infectious communicable disease. Residents show signs and symptoms of infection. The nurse can start isolation prior to the doctor ordering isolation, but it would need to be, you would need an order within 24 hours from the doctor. PPE, personal protective equipment, isolation equipment. We have gloves as a barrier to keep microorganisms from getting on your hands. We have masks to keep contaminated air from getting into your nose. It's filtered through the mask. Gown, goggles, protect your eyes. That's where we keep our isolation supplies. Now she's putting on her isolation supplies. They're also kept in the shower room too. When we set up a room, we have 2 metal racks that we use. One for trash, one for linens. Now she's done with her hairs and she's taking off her gloves. She's washing her hands. The reason is because she's going to go back with her hands to untie her gown. And when she's done with that, she's going to wash her hands again. And she's happy. She's got her gown mask on properly. Look at this picture taking off your gloves. The state actually cited a nursing home for the staff not taking off their gloves properly. See, you grab the cuff of your glove and you get it totally off, and then you hold it in that hand and slip your hands under that cuff and take it off. I will show you that during the orientation. It's pretty hard to make out real well in this picture. We wash our hands after we take off our gloves. For barriers, so you don't get contaminated with fluids, in the soil utility room we have a rubber cape and goggles. Okay, so how do we set up and maintain an isolation room? Again, 2 metal frames that I showed in the video, and laundry and trash frames. Their equipment they'll keep. And then when you double bag out, bring the linen down to the soiled linen side of the laundry. And then we have a biohazardous closet, which is down Green Hall, and she's going into that. It's locked. Oop. Infectious control, disposing of biohazardous waste. She's double bagging out. That's for the linen. And she's bringing it into the soil utility room. Now this is the biohazardous waste. That will be thrown away, not recycled. Thrown in the garbage there in the green hall. And we've got to keep the isolation closet clean. We have barrels, but sometimes they get full, so we have boxes. We need to put them together and put the red bag, line it, the box with the red bag. Okay. Disposal of infectious waste. Items soiled with blood and body fluids, gloves, gowns, paper towels, tubing, cotton balls, anything that's saturated with blood or copious amounts of bodily fluids. Disposal of infectious waste. We have a needle disposal on the side of the medical cart, the med cart, and then we have one in the clean utility room, and then there's one in the treatment cart. You have to be careful with sharps. One, if it's contaminated with blood and the person has hepatitis, you have a 1 in 20 shot of getting hepatitis. Disposal of infectious waste. We place them in the red biohazard bag and double bag it as we talked about earlier and discard that in the green hall closet. Disposal of infectious waste, clothing and linen soiled with blood, not saturated, you can put in the yellow biohazard bag and bring down to the dirty side of the laundry. Our isolation cupboard has all the supplies you'll need for isolation, gowns and masks. We showed that. And care of blood spills. We have a blood spill kit. There's instructions there on how to use it. And what it says basically, these are granules. You spill this onto the blood spill. Then you let it solidify. Then you sweep it up with this little dustpan. And you put it into the biohazardous bag. Obviously, you've already put on your gloves. And as I said, there's instructions there. It's be easier to describe when you're looking at it. The large blood spill kit, again, has instructions with it and has all the supplies that you need. The locations of the blood spill kit in nursing, it's in the treatment room. We have, if it's a big spill, we have Quetzal in the clean utility room, and it's locked up and it's above the sink. In Lake Villa, we have a large blood spill kit there as well. And the Quetzal is actually in the kit. And in the kitchen, they have a blood spill kit right near the dirty side of the kitchen on the very, very top of that shelving unit. Any employee who has come in contact with body fluids through needle stick, mucous membranes, eye sore, etc. must contact the charge nurse, who will follow policy and procedure for care and follow-up. Hand washing. You need to stand back from the sink so your uniform doesn't touch it. You need to use warm water and antibacterial soap. Turn on the faucets. Your hands should be lower than your forearms. Wet your hands at least 2 to 3 inches above your wrists as well as your hands. Give special attention to thumbs, knuckles, and sides of hands. Use friction between your fingers. Rub your nails so that they get soapy. Dry your hands with a paper towel. Shut off the water with the paper towel. And open doors with a paper towel if possible. Recommended hand washing, 2 minutes at the beginning of your shift, 10 to 15 seconds between patients, before serving food, after giving meds, 1 minute if you're ever contaminated by body fluids, and 1 to 2 minutes after caring for a resident with an infection, and after personal bathroom use. The CDC endorses the use of alcohol hand rub in the United States. Each room has a hand gel dispenser, and they are very good. You can use them between patients. I find that my hands get gooey if I've used them over 3 times, so then you would have to clean your hands. And obviously, if you have any visible soil on your hands, you need to wash your hands, not use the hand gel. Compliancy with soap and water washing is 10 to 15%. For hand gels, it's 40 to 80%. And hand gel is much less drying than soap, and the CDC recommends that you lotion your hands too when you use it after you're done using the gel. So if you follow this information you learned in this presentation, it will keep you safe here at Divine.